Mulliken from Extreme Makeover has developed 2 incredible new plastic surgery procedures. Now look at this before and after picture. That is unbelievable, Dr. Mulliken. Unbelievable. But the doctor is here to tell us about these new cutting-edge procedures, and please welcome him. All right, so what are the names of these 2 plastic surgery procedures?
Well, the 2 procedures, the first one is called a superficial cheek lift. And what that does is it rejuvenates the lower eyelid and the cheek, and it slides up the cheek.
Okay.
And then the second procedure we'll talk about is called Livefill. And that's where we take tissue from the patient's tummy usually.
Very excited about that.
Very excited, right? Put it in hollow areas of the face, like the smile, the marionette lines, and we can even use it now as cheek implants. So it's all the patient's own tissue.
Well, we have a before picture, so let's look at a before picture.
All right, here's a little bit older gentleman, and he was concerned. You know, we did some laser resurfacing, you'll see in a second, but he was concerned about the area underneath his eyes, that it looked, you know, a little old and kind of tired looking. So what we are going to do on him is a superficial cheek lift.
All right, now let's look at the after picture. Wow.
Right. Now what we've done is we've raised up the cheek, so that went up, and then we've done that all through a little incision below the lower eyelid right there.
And more and more men having plastic surgery?
More and more men. And it was first the gay men who came in. They were leading the charge. But now, yeah, of course, you know.
I can't even imagine what it cost.
Well, usually with all the operating room and anesthesia costs, it's around $7,000, so it's not cheap. But.
And you've been doing this more and more?
Yes, we've been doing a lot of these. I just presented a series, and we've done over 400 operations, superficial cheek lift operations.
So this is somewhat new?
So it's somewhat new, right.
Okay.
Where do the scars go?
So
y'all never tell folks where the scars are.
No.
And is it one operation and it's done?
Right. The superficial cheek lift is one operation, and we make an incision below the lower eyelid. So it's just like an eyelash incision.
After surgery, does it hurt right away?
Well, after any surgery, you know, you can't move the parts that got operated on.
Right.
That's the whole thing. You have to let them heal and rest. And actually, that's one of the big things about this operation. People feel great, but we have to tell them, hey, you cannot work out a week after you have surgery.
It is surgery.
It is surgery, absolutely.
Okay, well, if you folks at home right now are wondering how you can make your lips look plumper and your lines disappear, stay with us because Dr. Mulliken will explain his other innovative procedure. It's called Livefill after this.
Next, Extreme Makeover's Dr. Mulliken explains his Livefill procedure and why it works better than anything else, and you'll see the results.
We're back talking with Dr. Brent Mulliken from Extreme Makeover, and he's been telling us about 2 incredible new plastic surgery procedures that he developed. Now, Dr. Mulliken, tell us about Livefill.
All right. Well, what Livefill is we take the tissue from the patient. So it's not fat injection, but we're actually harvesting a little bit of tissue, and then we put it in areas that need filling, like the smile lines or the puppet lines or the lips, or we can even use it now as cheek implants.
And it lasts longer?
It lasts forever.
Forever?
Right.
Forever.
Right.
Everybody likes that. Well, we have a before picture, a before Livefill picture.
Right.
All right, she's a very pretty lady.
A pretty lady, but was just bothered by, you know, areas of hollowness, like her smile line here, and then the puppet line here, and then her lips. She felt that her lips just weren't full enough.
Now, this after picture is incredible.
Yes, and what we've done is we've put in the Livefill, not just a little bit. We've put a lot in this whole triangular area. We put a lot of Livefill in here, in this marionette region, and we put it in her lips also, and it has stayed.
It's like almost like you've had more than one procedure, right? Because you have to do like a liposuction or what to get the fat from the other area.
Well, we don't use liposuction. That's the way fat injection is done. And the problem with that is, unfortunately, the cells get damaged. So by the time you've done fat injection and you inject it, maybe 20% of the cells are alive. With Livefill, they're all alive.
So how do you take the fat out?
You make a little incision, usually at the lower part of the tummy, and then we actually harvest the Livefill. We make little custom, they look like a little teeny string of pearls.
Well, we actually have one of your patients here.
Oh, great.
Lola Sammartino, please stand up. Now, Lola, what did you have done?
I have done a superficial cheek lift and the Livefill.
Oh, so you did both?
Yes, I did.
Well, you're very beautiful now. Let's look at your before picture. Big difference.
Yeah.
Big difference. Lola, are you pleased with the results?
Sorry?
Are you happy with the results?
I'm more than happy. I mean, big time. When I saw the results, I thought, my God, this is like unbelievable. Because first of all, it's like, it's not what you expect from like a big surgery. You think you're going to get pulled up and look fine. But this was like amazing because I looked like so rejuvenated, so rested, like I came from a vacation. You rested, you slept a lot, and that's it. And it's beautiful.
Thank you, Lola.
Yes.
Now, Dr. Mulliken, we mentioned how you're on Extreme Makeover. That's how we all know you. What's the most number of procedures somebody's had done on the show?
Yeah. You know, we need to be a little bit careful because we prepare these people so well. They see so many doctors before their surgeries. But, you know, if it's all safe and everything's okay, we might do as many as, 15 surgeries on somebody.
15? But now, can't you have complications from that? Like,
you certainly can have complications. Any surgery can have complications, and people need to understand that.
Anyone
make
can
sure
have.
they can do them all, right?
These people have cardiologists, they have internal medicine doctors, they get heart tested, and then if one heartbeat skips, we'll save the rest for another day.
Yeah.
But it must feel great to change people's lives like that.
It's wonderful. The people are so grateful, and they need it so badly.
Do they still call you after the show and say, thank you so much, and my life has changed? And all that?
You're going to see on Extreme Makeover, if you watch the next season, that one patient actually came back with his wife. They got pregnant on the night he got home, and they had been told they couldn't conceive because he was so hot looking.
That is a makeover.